Good afternoon, everybody. Welcome to the family and friends of these graduates as you continue your support and celebrate the success of these students. I'm so honored to be here with you today, and I'm grateful for the opportunity to be a part of this ceremony. Most importantly, I want to just one more time, congratulations, class of 2018. I see smiles on your faces. We can clap one more time. You guys look happy. You look happy. Graduates, doesn't that sound great? Yes, indeed. You represent a bright future for nursing, for our profession, and for healthcare. You are needed. You will play an important role as caregivers, teachers, researchers, and leaders. You've worked hard to get to where you are today, and I'm guessing that you, and maybe some of those close to you, questioned your sanity from time to time as to why you decided to go back to school. And I think today is proof that it was a great idea. I am proud to be an alumnus of this school, and I am proud to be your colleague. This obviously is not your first graduation ceremony. Including high school, you have participated in at least 2 previous graduations, so you know the drill about commencement speeches. The speaker in front of you has many years of experience, not just old, but seasoned, which is the term I prefer. There's an expectation that I will impart inspiring messages for you to ponder or provide advice that will guide you to a successful career and life. No pressure. However, I humbly stand here knowing that most people do not remember much or anything from the keynote commencement speaker. So that takes some pressure off of me. My final disclaimer, my words today are not evidence-based or peer-reviewed, and there will not be an exam when I'm done. In thinking about what to focus on today, I looked back at my more than 30 years in nursing. It was clear to me that some things have thankfully remained constant, such as our focus on providing ethical, equitable, person-centered, and compassionate care to our patients. Looking at our patients holistically as individuals, body, mind, spirit, and also in the context of the larger community in which they live. One aspect of our profession that has changed and is changing rapidly is how we interact or connect with our patients. We have entered the era of connected care. I'm going to focus on this concept of connections or being connected from 2 perspectives: what it means to connect with our patients, the ongoing evolution of how we connect, and the overarching question, are we focusing on the most meaningful connections? So what does it mean to connect with your patients? The patients have a point of view on this as well. A brief story. Several years ago, I worked in a family practice clinic. I was the only nurse practitioner in this large clinic. The physicians were fantastic, and their patients loved them. These physicians were so good, they could have been nurse practitioners. I would have made that same joke with them, and they would have laughed. A patient came to see me for a post-hospital discharge recheck. 1 week prior, he had an exacerbation of his congestive heart failure and was admitted through the emergency department on the weekend. In his words, he was in the worst shape ever. He thought he was going to die. He had a cardiology consult and was successfully treated with diuretics and other medication tweaks and was back home within 48 hours feeling great. A much smoother hospital course than he had anticipated. So I briefly commented to him. I said, "You were fortunate to have such a skilled cardiologist to help you through this." And the patient said, "Yes, he was probably good, but I would never go back to him." I said, "Why is that?" And he said, "There was no joking with the man." I agree with the patient that a sense of humor is important, and I advocate incorporating humor when it's appropriate into your interactions with patients. But for this man, what he was saying is that the most important thing for him was to feel a connection with his care provider. And for him, that was through humor. So what about the importance of these meaningful connections? Consider this headline: loneliness is becoming one of our greatest health risks. According to a 2018 AARP study, 1 in 3 U.S. adults aged 45 and older are lonely. The health effects of prolonged social isolation are equivalent to smoking 15 cigarettes a day. Social isolation is being referred to as the new silent killer, a major risk factor for a host of conditions, including heart disease, high blood pressure, and early onset dementia. We would all agree that it's important to make meaningful connections with our patients to foster that therapeutic relationship. But do we think about whether our patients have meaningful interpersonal connections in their everyday lives and what this means to their health? So talking about the ongoing evolution of connected care, there obviously has been a dramatic change in the many ways we can connect via technology. But what about the quality and value of these connections? But before I get into that, I'm going to take a quick survey, so this is going to require participation on your part, all right? By show of hands, how many of you, and everyone else can play along, how many of you have used Lyft or Uber within the last 30 days? Show of hands. All right. How many of you have used Airbnb within the last year? Again, lots of hands. How many of you have looked at your smartphone in the last 60 seconds? One honest person, and the rest of you are liars. Because I know you're Googling and fact-checking everything I'm saying. And maybe live tweeting, I'm not sure. All of these examples, Lyft, Airbnb, and even smartphones, have become available just in the past decade or so. We no longer consider these as conveniences. It's an expectation that we have these things available. As we come to expect more and more from our connected world, our patients have become more savvy consumers of healthcare and are demanding convenience. Although we're making improvements, we have a long way to go in providing the same level of connectedness and service we have in other settings, such as banking and retail. Your input and leadership is needed to help us improve how we use technology to connect with patients. For the past 20 years, you heard some of this in the intro, I had the opportunity to work with 2 startup healthcare companies, focusing on improving the patient experience by providing convenient access to cost-effective and evidence-based care. In both cases, retail health and virtual care, our approaches were referred to as disruptive innovations, a term that is often overused, but refers to an innovation that is not mainstream and may displace an older way of doing things. The impetus for these disruptive innovations was based in part on a simple question: what does the patient want? To me, that should be considered a logical question and not disruptive. One area of connected health that is growing very rapidly is virtual care and telemedicine. To give that some perspective, and you know telemedicine has been around a long time, but currently there are approximately 80 million virtual visits per year, and that's an e-visit or a telemedicine encounter. By 2025, this will grow from 80 million visits per year to 1.5 billion virtual visits per year. We can see 2025 from here. Virtual care will be a part of your future. The growth of virtual care has spawned new terms. Have you heard this one? Website manner. Yes, that's a real term, referring to the new skills that you will need to most effectively provide care using these telemedicine tools. Work on that one, website manner. And also in your career, other areas of rapid growth: connected devices, pharmacogenomics, artificial intelligence, machine learning, and augmented reality tools. Those are here now, and they will be part of your practice at some point. Although one might have concerns that these technologies could make the care that we provide less personal, or that we might feel less connected to our patients, but connecting with patients electronically or virtually does not mean that we are disconnecting on a personal level. They are not mutually exclusive. In fact, the combination of in-person and virtual care can enhance the quality of interactions by allowing the patient to have more connections, better access, and more control, which in turn can improve adherence to treatment plans and also ultimately improve outcomes. I wanted to talk briefly about electronic health records as well and how that has entered into our day-to-day practice. Along with many of the advantages of electronic records, in many cases in the ambulatory care setting, they have changed how we interact with patients, often making it difficult for us to even make eye contact with our patients. I heard a story about a child who was asked by her mom to draw a picture of her pediatrician. The child drew a picture and handed it back to her mom. The child had drawn a picture of the back of the pediatrician's head. Yes, children tell it like it is. She remembered looking at the back of the pediatrician's head as she sat there documenting in the electronic health record. I'm guessing that many of you have experienced similar challenges where the exam room layout makes it difficult for you to be and to feel present with your patients. These one-on-one moments that we have with our patients are really a privilege. The time when the patient is trusting us and sharing their most deep concerns. Some refer to this as the sanctity of the exam room. We cannot allow a screen to diminish these moments. Many are asking the question, are we serving the technology instead of the technology serving the care of our patients? And this is where you come in. We need you. We need nursing to help shape the future, to ensure that technology is helping us to provide meaningful connections with our patients. Yes, there are many challenges that you will face as you enter this new phase of your career, armed with your shiny new degrees and the superpowers that you've earned. You are more prepared than ever to face these challenges. We need you, and we're glad that you're here. The University of Minnesota School of Nursing, my alma mater, I'll just keep saying that, has prepared you well for this next step. Your faculty and advisors have been excellent role models. You are in a position to not only participate in, but to lead us into the future. Strive to maintain the ethical principles of the care you provide. Create and guide innovations that will improve the experience and the outcomes for patients. And speak up when innovation makes it more difficult for you to care for your patients. Whether you are on the front lines of providing patient care in administrative or leadership roles, academics, policy, advocacy, informatics, or a budding entrepreneur with an idea, you will play an important role in the future of healthcare by connecting in sometimes new, but most importantly, in meaningful ways. If you were to have a visit with my congestive heart failure patient, what would he say about you? Could he joke with you? Be kind to yourselves. I know that we tend to be a little bit perfectionistic. Is that an understatement? I think I see a few. Yes, we can be hard on ourselves. You are human. You will make mistakes. We all do. And also be kind to your colleagues and strive to strengthen collaborative and interdisciplinary relationships. We are in this together. Class of 2018, I wish you all success in your professional, personal, and connected futures. Enjoy this moment. I hope we can stay connected. Thank you.